My question is relating to the myocarditis for young people with COVID-19. I'm a registered holistic nutritionist in Canada, and I run, I see clients to help them with their nutrition, and that always edges them as much as possible towards a whole food plant-based diet. And I've had very consistent with everything that you teach, and in these programs, I've seen tremendous transformations of people just simply by guiding them in that direction and helping them understand what's good for them, what's not. I have a new client who was asking, so he's 20 years old, who has suffered this. They have made him part of the study. The only conclusion is that he has unfortunately suffered a vaccine injury from the COVID-19 vaccine. I did a scan of the literature, and I'm not a doctor or a regulated health professional. I'm a registered holistic nutritionist, so I can't diagnose, treat, but I do look for the literature to see where it's nudging you. Is there any evidence of dietary interventions? I don't see anything yet about this particular condition, but I have a hypothesis that we've seen so much success with other cardiovascular conditions that simply guiding him towards a whole food plant-based diet is going to be the best intervention that we know at this point to help him recover. I wonder if you have any opinions, or if you perhaps know something that isn't maybe available to the public yet that I might suggest to help this person.
Yeah, so as I understand it, he has myocarditis after getting the COVID-19 vaccine. And I'll have opinions, but I can't unequivocally give you an answer because I don't think we know. There clearly is an association with better outcomes when you get COVID-19 in general. I'm not talking about the vaccine. So I'm going to circle around the point for a moment. There clearly are associations of better outcomes when you have a healthier dietary pattern. The incidence of myocarditis is much higher from COVID-19 itself, the viral infection itself, than it is from the vaccine. So we certainly encourage people to be vaccinated for a whole host of reasons. But you're much more likely to get a myocarditis from COVID than you are from the vaccine. But, there is an association with myocarditis and the vaccine. I'm not aware of any specific treatment for it, whether, it's from COVID or from the vaccine. There can treat related symptoms. The course tends to be better when it's from the vaccine. Probably a healthy lifestyle helps. That's about all I got. So I just don't have a great therapy for that. My hypothesis is that a plant-based diet would be helpful, but I can't unequivocally prove that to you.
Thanks very much for that. And up next, we have Yaron. Welcome.
Hi. Hello, doctor. Thank you very much for your great presentation. So I did a few years ago, 3 years ago, a cardiac calcium score test, what's called CAT scan, because of a family history. My dad, got a very young heart attack and died from it. And I got a very high score, although I did not have any symptom. So I decided to switch to a full plant-based diet and change my lifestyle. And now, after about 3 years that I've made the change, how would you recommend to make a follow-up to see if my situation been improved? Would you recommend to do any other test, do the CAT scan again, or do any other test? Because there is, I know, some radiation with this test. What would you recommend? Thank you.
So I'm not able to give out specific medical advice. I think in general, when someone just either pre or post knowing you have atherosclerosis, by here in this case, I mean knowing is having a positive coronary calcium score. So that being more healthful can be quite useful for you over one's overall health. Oftentimes in these situations, when someone has atherosclerosis, in addition to lifestyle, we might add a statin. But in terms of follow-up testing and other things, I really need to leave that to your personal physician, because there are many variables that go into dietary recommendations, medication recommendations. So I'm really not able to go beyond that, but I do think it's wonderful that you adopted a healthier lifestyle.
Thanks for that, doctor. And up next, we have Ed. Welcome, Ed.
Let's see. Am I not muted?
Yep, you're all set. We can hear you.
Okay. I'm asking this question for someone who would not be understandable on their own. This is a 70-year-old, 100-pound woman with Crohn's disease who was diagnosed with a heart attack after the fact at the age of 67. She eats a whole food plant-based diet. She comments probably too much sugar, and exercises regularly. LDL 39, HDL 36, triglycerides 132. She's on a baby aspirin, 50 milligrams of metoprolol, and 20 milligrams of atorvastatin calcium. And she wants to know, does it make any sense to be on these drugs? You know, we thought with low LDL, you didn't need to be taking drugs.
Well, again, I'm going to need to defer to her primary doctor about that. In general, for LDL, I mean, if someone stops taking the statin, LDL will go up a lot because they work very well.
Well, her LDL was very low to start with.
Well, so I mean, I'm not able to give out specific recommendations for her care. I can just tell you in general, that's what happens. And there is a substantial amount of evidence that lower is better. And, you know, there are some guidelines that recommend even less than 55 or lower, in particular high-risk situations. So in general, when someone has had a heart attack, and it is quite common to see them on an aspirin and a statin. That's very common, and oftentimes a beta blocker as well. That wouldn't be a surprise to a cardiologist to see that group of medications. And we think about it as all of the above one, of course, lifestyle and medications. And I'm sorry, I just can't get more specific for an individual person because everybody's got different things going on.
That makes perfect sense. Thanks very much, doctor. And up next, we have Kaylee. Welcome, Kaylee.
Thank you. Hi, this is Kaylee Covington. I want to thank you so much for having seen me several times over the last years, for your patience, for your commitment to what you believe in, and yet for allowing me to make my own final decisions and being supportive nonetheless. So I want to let you know that without statins now, I've gone down to normal blood pressure. And I'm so happy, and I'm so grateful that you're on the planet and that you're helping people and that you are whom you are. So thank you so much.
Well, thank you for those kind words, and I'm glad you're doing well. That's wonderful.
Thanks, Kaylee. And for everyone else, at the moment, I don't see any other hands raised. I've got a couple of questions for you, if that's okay. But I do want to remind everybody what a great opportunity to ask Dr. Ostfeld your questions directly. We have a few more minutes left. So if you'd like, again, just press your reactions tab and up comes a menu and you click on your raise hand function and we'll see your hand raised. So, for now, I guess my first question to you is, and if you've covered this, forgive me, but are there any nutritional supplements, vitamins, minerals, powders, probiotics that you recommend for any reason for your patients?
There are two supplements that I routinely recommend. The first one is vitamin B12. And of course, B12 lives in the soil. It's made by microbiome of bacteria in the soil. And now that, when we get our vegetables and stuff, we'll say like triple wash, and then we wash them again. And so all the dirt is washed off of it. So you're not getting B12 that way. And animals get it because they either eat dirt or other animals that eat dirt. And so if you're going plant-based, you really have a very low exposure to B12. So I encourage patients, I just recommend they take 500 micrograms of B12 3 times a week. To start, I'll check a level and kind of go from there. That's just empirically how I've done it. But since we're using so many pesticides and things now, that people who eat an animal-based diet, very, very often they're B12 deficient too, because the microbes have been killed. So it's something that I've actually been screening for much more than I had been earlier on in my career, and I see low B12 levels a lot. So B12 is one. The other one that I recommend is an omega-3, and that it's not for heart health, but it's for brain health. And although we'll have, sometimes, you eat hemp seeds, chia seeds, ground flaxseed meal, that can give us ALA, but not everybody converts ALA to the omega EPA or DHA well. So I do that kind of to belt and suspenders. So those are the only supplements that I recommend.
Excellent. Thank you very much for that. And we now have a few more hands raised. So I'm going to go now to Rebecca, and welcome, Rebecca.
Hi, thanks. Can you hear me?
Yes.
Okay. Could you talk about the impact of soy and any impact on the thyroid, any negative impact on the thyroid?
Not that I'm aware of in lower doses, but to be honest, I'm not an expert in that topic, and I wouldn't be the greatest person to ask about it. I'm not aware of a negative impact at typical doses, amounts that you might get from, say, if you ordered out Chinese food or something. So sorry, wish I had better for you, but that's all I've got.
We appreciate your candor. Thanks, doctor. And up next, we have Cynthia. Welcome, Cynthia. Hi, Cynthia.
Hi, Dr. Ostfeld. This is Cynthia Lee. I'm so grateful to have you as being my wonderful cardiologist. I really feel much better following the whole food plant-based diet. That's all I wanted to say.
Oh, well, thank you so much for your kind words. I'm glad you're feeling better. That's great.
Yes. Thank you, Dr. Ostfeld.
Thanks for sharing that, Cynthia. We all appreciate that. And up next, we have Ulysses. Welcome.
Yeah, thank you, Doc. Have you given any thought to the inclusion of dark chocolate in the diets of your clients?
Yeah, sure. I mean, I think it's a wonderful treat. I've got some just 4 feet away from me. I mean, I don't have it on my list, my checklist of things I'll often give people to eat, but I do think that if it's, truly dark chocolate without the cow's milk, and the threshold that I've used for no particularly great reason is 70% or higher. I'm very for patients having, a little bit of dark chocolate as a treat, and also putting cacao, if they want, into a smoothie can be great. There was the Cosmos trial that just came out, and I don't remember all the details of it. And that study looked at a dietary supplement of cacao. And I think that there was some metabolic benefit. May have been neurocognitive as well. I don't remember exactly, but if you Google Cosmos trial, it'll give you the details. It was run out of the preventive medicine group at Brigham, and I believe Joanne Manson is one of the senior authors on that study. But there was some sign of benefit in a large randomized trial. Yeah, I think it's great.
Thanks very much for that. And now we're going to bring in, we're going to bring in Wendy. Hi, Wendy.
Hi, Dr. Ostfeld.
Oh.
It's great to hear you again. I've heard you in person a number of times. I have, I'm still confused about eating carbs. Right now, I actually just cooked dinner. I made a lot of vegetables. I made some Japanese squash. I just want to know how many carbs can you really have? And am I taking a risk in developing diabetes by having too many whole grain carbs, whether that's, whole grain bread or brown rice?
It's hard to say specifically for any one person. And it's not one size fits all, of course. Now, the C-A people that we mentioned in the jungles of Bolivia, they had, I think, only one or two of them. There were many hundreds of people in the study had even minimally elevated glucose, and their diet is 72% carbs. The study by Reynolds, where it was like 135 million person years of follow-up, they had more whole grains associated, I believe, with less diabetes. So the devil's in the details, really. And of course, the studies by Dr. Satija showed that eating a healthful plant-based diet, not sugar cookies, was associated with improved outcomes. So it's hard to say for sure for any one person. I do encourage my patients to have 3 servings of whole grains a day. That's like, brown rice, quinoa, that kind of thing. But some people don't do well with that. Some people need to have a lower carb diet, and that's something to talk about with your regular doctor. They can, or your RD, and they can follow various metrics like hemoglobin A1C and your weight and other things to try and help titrate a diet that's specifically helpful for you.